Hello, I'm David Minkoff, the co-founder and medical director of LifeWorks Wellness Center. My wife and I opened LifeWorks Wellness Center in 1997. For the past 26 years, we've made it our mission to help patients identify the source of their health issues and find a solution. I'd like to personally welcome you to LifeWorks Wellness Center, where your journey to health begins. If you are watching this, it means you've taken an essential step toward restoring your health. When you first come in, after some paperwork, you're going to meet with me or one of my other medical staff. We will review your medical history. We will do a thorough physical examination. We will talk about things. Our goal in that session is to actually find why did you get sick so that we can get the exact answers to how to get you unsick. That process takes about an hour. We will then do another kind of examination, which we call autonomic reflex testing. So the body has another system where it regulates everything in the body, and that's called your autonomic nervous system. So we have a very detailed way to look at that, and that gives us clues about which toxins, which infections, what is actually underlying all of the symptoms and complaints that other doctors have not figured out. The next part of that examination is actually take a sample of your blood, look at it on a microscope. We do that with you, and we can get a good idea of how serious is the condition, how much is your blood as a tissue being distorted by the infections and toxins that are in your body. That part, for most patients, is the most interesting part. They just want to look at their blood each time to see, is it getting better? And we keep photographs of these, so you look at it and it's all gnarly and it's diseased and it's in bad shape. They can tell. And then the next time it's better, and the next time it's better. And pretty soon it goes to what looks like really nice, healthy blood. And that often reflects exactly how they feel. You will then spend another 30 to 60 minutes with one of our service consultants who will show you what the detailed program is that we designed for you to kind of bail you out of this situation that you're in. On that basis, you can decide, are you ready to start? Do you need some time? We handle the finances with you, we handle the scheduling, and then you can go. On average, our patients need about 3 months of treatment. Sometimes it's a little longer. It's rarely more than 6 months. Many patients come from out of the area, and they may stay here during that time. Other people who are local don't have to. One of the things that's almost never evaluated by a medical doctor is the health of the teeth. Dental health equals physical health. If people have low-grade infections, root canals, materials like mercury in their teeth, there's a high likelihood that this is contributing to their ill health. We will send you to a biological dentist to get a special kind of x-ray of your teeth so that we can evaluate this further. If you then need dental care, we can discuss with you about how that'll have to happen. Part of our evaluation includes a lot of regular testing. So we do blood, urine, saliva, and stool on most patients. The common thing that people say when we go over that blood test at a later visit is, why didn't my doctor order these tests on me? Like, why did they order routine tests, but they didn't do the detailed tests that you do? And the answer to that is, they're just not up to date on what could actually be found in the body with regular laboratory testing. And so this gets us into the nooks and crannies. Do you have parasites? Do you have excess lead? Are you missing certain nutrients? Are the neurotransmitters in your brain functioning in a correct way? Is your metabolism optimized? What are your hormone levels doing? And so we get this whole battery of information, which then gives us a real true picture of what is actually wrong with you. And then based on that, we can fill in all those holes so we can get you back to health. Once the practitioner sees you, you will get an individualized program for you of take these supplements, do these IVs, get these tests done. We don't want you to wait for the tests to come back because we already have enough information from looking at your blood smear and doing our physical exam of where we need to go with this. And so we start you on the program. 6 weeks later, we'll see you. There will be things to add in because we have some more information, but there's enough to do at the beginning that I want you to do it. For most people, the treatment program is going to include some IV therapy. So IV means intravenous. If a person has a disturbed gut, which 99% of our patients have, the nutrients that they take orally may not effectively get into their body. But if we do it intravenously, we can get in the vitamins, minerals, amino acids, the various substances, homeopathics, that we need to restore things faster. We use things like pulse magnetic fields. This restores energy to the cell. We do things like saunas with ozone. So ozone is oxygen gas. The healer in the body is oxygen. And so various ways to get oxygen inside the body helps the body heal. We also use hyperbaric oxygen. Hyperbaric means high pressure. So you get in a tent, the pressure's high, you breathe oxygen, it floods your body with oxygen, which helps the person heal. A good part of the program will be with supplementation. So these are mixtures of vitamins, minerals, herbs, homeopathics to target the various infections, to help your detoxification systems ramp up, to kill the bugs and parasites that are living in your gut, to improve the level of, say, if your vitamin D is low or your zinc is low, to boost those levels up. We will also discuss with you a nutrition program, like what should you eat? And we have 2 dietitians on staff here which will meet with you and help you to figure out your food and your vitamins and minerals and how to take all of them so we can get all this stuff going. At about 6 weeks, we will do a recheck with you. So you'll have been on the program 6 weeks, you'll have done your IVs and your other therapies, you'll have been taking the supplements, and then we do a reevaluation of how are you doing at that time. We do this thing called a medical symptom survey, which is a list of all the complaints that you have, and it's numbered, so a person might come in with 100 or 120, and when that starts to go down, so at about 20 or below, people actually feel good. The symptoms that they came in with, we see them slowly diminish. So if you came in at 140, probably at the 6-week visit, you might be at 60 or 70 or even 50. And it's interesting because some people don't remember how bad they felt 6 weeks before. And how are you doing? Well, I'm doing better. Well, how's your headaches? Well, I don't have any headaches anymore. How's your joint pain? I'm just going through the list of symptoms with them. Well, my joints don't hurt anymore. Well, how's your sleep? Oh, I'm actually sleeping through the night. And then that reflects in the medical symptom survey. At that visit, also at 6 weeks, we do a complete lab review. So all the stuff we ordered up front, we go through that, and we find some things that we didn't find on the initial physical exam. Then the program will be altered a little bit, and we do another 6 weeks to 2 months of a variation on the program until people voice to me, like, I'm good now, I'm all better. And that's my go button of, okay, good. You don't need this intensive care anymore. I'll see you in 3 months, or I'll see you in 6 months. You keep on the nutrition program, you keep on the supplementation, and that should keep you good. And if you get in trouble, call. But usually these programs, within 3 to 6 months, people have their lives back and they're ready to live. And then they don't need us, which is really what our goal is. One of the things that you'll find about your program versus someone else's program is that it's individualized. The things that are wrong with you are not the same things that are wrong with someone else. This is even true of serious diseases. Like someone comes in with, say, pancreatic cancer or breast cancer or prostate cancer. In the regular medical field, the approaches are pretty much identical. You know, we're going to do surgery on you, we're going to give you chemotherapy, we're going to do radiation. But it's not individualized. So what we're doing is we are honed down to your condition, the causes that underlie your condition, and to be able to deal with those causes because they may be a little bit different than the next person or the next person or the next person. We get the best outcomes because we're doing individualized program. We truly believe in the strength and resilience that lies within you. As you embark on or continue your treatment journey, remember that every step you take is a move toward better health and well-being. This is the right pathway. We can help you. You are part of our family, and together we can make this happen. We look forward to seeing you at your next appointment.